All right, so we're going to jump into this. We're going to go into inflammation. Notice a big topic. So we're gonna give you some educational components about this, and then we're going to go into some strategies and things of how to minimize inflammation and educate you in the understanding that all inflammation is not necessarily bad. So first, we'll kick right into an overview of inflammation. So, obviously there's different types of inflammation. There's acute and chronic. So, and then there's a stress component, and then how to improve inflammation. So first, we're going to talk about inflammation. We're going to talk about the acute and chronic. Then we're going to dive into the stress component, and improve inflammation in general and how you can do that. So let's go ahead and talk about what is inflammation. Inflammation is part of your body's immune response. It occurs when your body tries to heal damaged cells, and it fights off irritants and pathogens. So it's a natural response for your body to, heal itself, or if there's some foreign pathogens in there, the inflammation will occur. What will happen is when that response is activated, your arteries will dilate, blood flow increases, and the white blood cell hormones and nutrients flow freely. So there's a response and a reaction. So inflammation is not necessarily bad for you. Obviously, if it's acute component, the injury area is swarmed by white blood cells along with fluid that causes the awful painful swelling component. You know that if you turn your ankle, it swells up. That's inflammation response. It helps in the healing component. So now we'll talk about a little bit of the differences in acute and chronic. Now, obviously, acute is, like I just said, when you turn your ankle, that is an acute inflammation or acute response. And then when you think about chronic, you'd go into more of a stress aspect. Body thinks there's a irritant or threat. You're out of balance, you're out of whack. So that would be a stress aspect, because your body doesn't know the difference in between a stressor and a non-stressor. So, your anxiety and things of that nature and chronic stress can be detrimental to the body, but we'll get into that. So inflammation is not always bad for you, right? There's acute and chronic. So a little bit of inflammation is good. A lot of inflammation consistently may not be good for you. So chronic levels, or cortisol levels increase, fight or flight component. That's when you're stressed out. And when this happens, it inhibits insulin production and increases the heart rate. So that's a stress component, and it affects your hormone cortisol. So the fight or flight, again, that would be in that chronic phase. So again, the inflammation gets a bad rap sometimes, but it's not necessarily bad for you, because I'll talk to you a little bit more about that. So when we talk about chronic inflammation, so chronic inflammation can cause many health-related problems, and I'm going to go through some of these, because if you have chronic stress, this may be a result or what's going on. Acid reflux, skin conditions like psoriasis or acne, arthritis, bronchitis, diabetes, high blood pressure, signs of aging like wrinkles. If you see like the president coming in, his first picture and the picture going out, if he's served a term or multiple terms, obviously the aging process on the president's always interesting. You'll see the wrinkles and aging from that stress component that they're under leading the nation. Frequent illness due to colds and flus, so your immune system is compromised when you have chronic inflammation. You may have chronic pain, so some plantar fasciitis or fasciitis kind of things, more in the fascia area. Fatigue, mouth soreness, chest and abdominal pain. That would be more along the lines of not only the stress component, inflammation component, but then also obviously the anxiety component. So things you want to be aware of, if you eat too much fat, sugars, drink too much sodas or caffeine, and don't get enough exercise, sleep, and water, it can cause all kinds of inflammation. It's quite interesting. This is why we preach, a balanced diet and exercise and activity, because it helps control your inflammation. So next, we're going to kick into stress and inflammation. So again, I touched on this. Your body doesn't know the difference between a real stress or a created stress. Again, that's the mind or fight or flight. And then long-term stress can cause problems with immune system, digestion, heart, obesity, and fertility problems. And we've seen this in clients. So just think about that. If you have a lot of inflammatory response, it's going to really affect your life. So stress can increase cortisol levels, and I just talked about this, inhibit insulin production and increase heart rate. So stress, all the time is not necessarily very good for you. Obviously we just went through this pandemic, and that's a component of that. A lot of people have higher rates of inflammation. And also if you have a good amount of stress, then our other habits may not be good. So you may go into some outlet, and it may not be exercise. It may be like smoking, it may be drinking, increased in the amount of caffeine. So all those components again will affect inflammation. So we're going to go into how to improve inflammation. So minimize processed foods, sugars, alcohols, and caffeines. Figure out if you have food sensitivity, because that can cause inflammation. Floss your teeth, improve your sleep, reduce your body fat, learn to implement breathing techniques, and work out. So I will kind of talk through different strategies and the effects of those strategies here. But another thing is okay, how else do we improve inflammation? Well, working out will reduce overall inflammation. So when you exercise, and it can be the resistance training is really good for this. Also, cardiovascular can help this as well, because when you exercise and you're moving your muscle cells release a small protein. It's IL-6 is the protein that is released, which appears to play an important role in fighting inflammation. So inflammation is the body's way of healing itself. So after a workout, your body and muscle contraction, and they correlate this with heat as well, because it's a mechanical reaction, is the IL-6 protein is released. IL-6 has been shown in studies, multiple studies, to lower the total body's inflammatory response. So what I'm saying there is, if somebody works out on a consistent basis, is standing beside somebody who doesn't work out, the person who works out, their total body's inflammatory response is lower in comparison to somebody who doesn't work out, because the IL-6 protein is the main factor in pulling your inflammatory response down. So the biggest factor in determining how much IL-6 is released is obviously the amount of exercise you do. If you do a little bit more exercise, it's going to lower. Obviously, it's going to affect more of the IL-6, or more of the IL-6 is produced, and then that's going to help lower the inflammatory response. It's your body's natural response to heal itself. Again, like I said, the inflammation is not always bad. So think about it that way. If you want to manage your inflammation, working out is one of the best ways to do that. Resistance training is one of the best ways to do that. So just think about that. And then I know I touched on some of these. I'm going to go to a bigger list of how to improve overall inflammatory response. Obviously, don't overeat, especially sugars, fats, and caffeines. Okay, this inflammatory response. Figure out if you have food sensitivity, floss your teeth, get more sleep, watch your substance abuse, alcohol consumption, lower your body fat, reduce stress, learn how to breathe better, so controlling your central nervous system. Use hot or cold therapies, because the hot and cold therapies, and more of the hot therapies, it affects that IL-6, that protein 6 will pull your natural body's inflammatory response down. And utilize a good essential fatty acid supplements. So essential fatty acids will help pull the overall protein down. So this is a list of things you want to implement to pull down your overall body's inflammatory response. Again, inflammation is not bad, because inflammation can heal the body, and that's what it was meant to do. Extreme amounts of inflammation can be bad and can cause long-term effects on your overall health. And when you get into overtraining, you're not getting enough rest, your inflammatory response goes up, you don't feel well, you're achy, things of that nature. So there's always a balance there. So hopefully this helps. Again, we want to control our inflammatory response, but there's a sweet spot. Inflammation is not always bad for you, but how to control it and being able to control it is very important.